Welcome everyone and good evening. We are so excited to talk about rhinoplasty today and all the little intricacies and operations that are involved in rhinoplasty. It's easy to call it a nose job because that's what rhinoplasty is. But everybody's nose is a little bit different, and we're really two people squashed into one body because we're made embryologically where we're two sides. So we're all asymmetric, and we all have the things about our nose that bother us because it's this thing that sticks out from our face. And you don't hear about people talking about their beautiful rhinoplasties. You hear about the big noses and the crooked noses. So the goal of rhinoplasty is to make the nose disappear into the face so that all the other parts emerge as being so great. So come in and we'll tell you and we'll show you all the things. Don't forget that the best part of all this is the live Q&A at the end of the talk, because there you can ask all the questions that you want. It's all anonymous. Other people can't see that you're asking, so that you can get the answers, all the questions you want to know. Everything you were afraid to know or afraid to ask and were afraid to know, whatever you want to talk about, we're here to answer the questions and give you some really good information with some cool technology to help you basically have the operation without having the operation. So welcome and thanks for coming. So what is a rhinoplasty anyway? Is it a nose job? Yeah, but a nose is a fairly complicated organ and has a lot of different parts to it. So let's take a look. Here's my little friend, a sculpture that I made. And here you can see the nose. So there is the dorsum of the nose. That's the top up here. There is the tip of the nose. There is things to think about the width of the nose. And in addition, there's also what's in the back, which is the whole breathing mechanism of the nose. So the nose works both functionally, breathing, and also aesthetically, how it looks in balance. So our faces are aesthetically in thirds, 1/3, 1/3, 1/3, and in fifths, 1, 2, 3, 4, 5. So it's all about balance. So when you think about noses, it's how do you make sure that the breathing stays or gets better if it needs to, or stays good, and also how does the nose fit onto the face? Because this is a nose without the rest of it. This is a nose with the rest of it. And fortunately, we spend our time having our nose on the rest of our bodies. So it's good to think about noses that work for your own, what you like, but in keeping with the rest of your face. So as we go and learn about rhinoplasty, always think about how it works with you and the rest of you. So this is the vector program, which I find to be really helpful because you can see before and afters. You can morph and see the different positioning, and it has all these many views. It's also helpful because I can adjust as you need, and we can zoom in. It's really a good way to get a sense of, it's like having the operation without having the operation. Big and small. When you go, you can see how you can raise the tip and reduce it. Each one has a different component, and wider and narrower. So what are the benefits of rhinoplasty? Well, there is the aesthetic benefits and there is the reparative or reconstructive benefits of rhinoplasty. And it's good to think of both of those at the same time. So what is the benefits from reparative or reconstructive? That you can breathe better, that you have the ability to sleep better, and also important, not to sleep worse having the operation. So these are all important things to consider. From an aesthetic standpoint, it's so that the nose disappears into the face, so that it's not a big feature, so you can see the other parts of your face. And noses are really fun to do because they're always challenging, and yet because they're so prominently featured on our faces, it creates such a big impact for people. And I love taking the splint off after a week and seeing people's faces. Sure, the nose is still swollen, but there's this very deep satisfaction I get from seeing people so happy. So we're learning about your nose and what you don't like about your nose and what you do like about your nose, because it's always important to figure out what is it that you like and what is it you don't like. So we're going to take a look over here, and this is the inside of your nose. So these are the cartilages, upper cartilages, lower cartilages, and it's the same view but from underside. These are lower cartilages. And from the side, this is your septum. That's what makes the breathing if it's on one side or the other, because our noses really are two sides of the same story. So, and this is the septum after you peel away the cartilages. So these are all four together. So it's really good to diagnose before you treat. And so if you want to have a narrower nose, then you need to know, okay, what's causing the width? So it can be on this side. Let me give you a mirror to see. You can take a look. So when you take a look. So if you look in the mirror, you can see how the parts of your nose correspond to the pictures. So here we have the tip, and the side of the nose is called the dorsum. If you just turn your head to the side a little bit, so there should be a straight line that goes from the top down to the tip, and then if you turn to the other side, it's often people say, oh, I have my good side, my bad side. That's because we're all asymmetric and we're put together side to side. If you tilt your head up, that's where you can see if your septum is in the midline, and it's also how your nose balances with your forehead and the rest of your face. So if it's too wide, we can make it narrower here, we can make it narrower here, but you don't want it too narrow. It's very much the Goldilocks. You want it narrow, but not too narrow. You want it to be straight, but not too straight. These are all things that come into play because we're all humans and we want it to look natural, but great. What's the downtime? Well, you have a splint for a week, and then the splint comes off, and you're still swollen, and you don't see the final result for a year, but you can function pretty well after a couple weeks, but even after a week when the splint comes off. And you asked also about complications. Well, there's always a chance of bleeding and infection, low risk, but can happen. Probably the biggest risk of any cosmetic operation, including rhinoplasty, is that you're not as happy as you want to be. And that's why I work really hard before the surgery to have enough face time so we are clear exactly what your goals are, what we can achieve, what's realistic, what's unrealistic, what's balanced, and then we go together to do the operation. So you wanted to know why come here, why not go somewhere else? Well, besides, decades of experience and also the greatest technology to really see and have the operation without having the operation, so you really know what's going on. Basically, nobody cares more than you about the result except for me. And that is why I love this operation. It's a fun operation. It's always challenging, but always rewarding for the patient and for the doctor.
Thank you so much for joining us this evening for our rhinoplasty presentation. Reminder to please stay until the end. We'll have a live Q&A. It is completely anonymous, so please don't hold back. You can answer all your burning questions, and Dr. Korman will answer them. You will also receive a text at the very end to reply back if you'd like to schedule your consultation. Also, reminder, staying till the end, everyone will be entered into a raffle, and we will reach out to you in the week to come with those winners. Thank you, everyone. Look forward to our Q&A. Good evening, everybody. Thank you so much for joining us. I'm Nicole Black. This is, of course, Dr. Korman. Hope everyone enjoyed tonight's webinar. Not sure if it's your first one with us or third, but so happy to have you here. Perfect. So we're going to dive into some of the questions. Thank you so much. We didn't say it enough. It is anonymous. We want everyone to feel like it's a safe place to ask anything they'd like. So diving right in here, the first one. So Dr. Korman, what are your thoughts on a liquid rhinoplasty?
So liquid rhinoplasties are really cool. Liquid rhinoplasties, in case people don't know what that means, it's just taking some filler and putting it in usually the dorsum of the nose, the top of the nose. I think liquid rhinoplasties are actually a really good way to kind of see what it'll look like, because usually the material is temporary. Now there are some longer lasting fillers also, but I think it can be good. The thing to understand is that it's not a magic wand. What it mostly does is if you have indentation or a bump on your dorsum, that's right here, you can put some filler in from to the side so that you fill in the valleys so that you have more of a straight line. So again, it's not a magic wand for a lot of things, but it is for a small defects in the dorsum of the nose. It can be really good, and who wants an operation when they don't need one?
Let's see. Awesome. And then quite a few questions just about deviated septum, breathing issues, so more functional versus cosmetic rhinoplasty, and what does insurance cover, and kind of how does that work?
So it really kind of depends what the breathing situation is. I think a lot of times people think that they can just get sort of insurance covered. So what I do is, when there is a functional component, when there's a breathing component, I have the patients see an ENT colleague of mine who then can do the functional part at the same time as I do the aesthetic part. I find that there is more chance when a functional physician is requesting coverage for them to cover the insurance part of it. It's important to understand it doesn't mean that the whole thing gets covered, that in any event, when there is an insurance component, the insurance component gets covered, and we work with you in our surgery center, which is accepts most any insurance, then it helps with the facility anesthesia for the insurance component. So we try to get you as much coverage as possible within what is legal and what is appropriate.
And can you travel on an airplane after surgery?
You can. I wouldn't travel the next day, but I think within a couple weeks you can.
I think that's a really good segue into our next question about downtime and wearing a splint, and is the nose packed? What is that immediate recovery like? And then recovery to return to exercise and feeling well to kind of, it looks like, go out in public, it says.
Yeah, so the first part of the recovery to just function, to be able to go to the bathroom, obviously you can do that right away. The first few days, you're trying to just recover and make sure you're breathing appropriately. The nasal packing, if it's in your nose, may be in just overnight, or it may be in for a week. But the idea is to still, if it's for a week, it's not packing. It's just an internal splint. You have the external splint for a week. After a week, all those things come out. And the important thing is for about 3 weeks, you should not bend over. If there's something on the ground you want, you squat down to pick it up. Exercise starts at about 3 weeks, but not with any contact sports. Contact sports, you have to wait longer. But in general, it's a few days, then a week, and then 3 weeks. That's kind of the sequence.
And how long? So a few people said, kind of, how long does it last? That one person saying that they've seen other people where the shape changes over the years. Do you find that that's the case? And should someone in their 40s get it if they have to retouch it in time? So I guess part one of the question is, does it change shape in time?
So if you ever look at coins, British coins, and there's, if you look at coins when Queen Elizabeth was a young person, and remember these are just silhouettes, and then you look at coins when she was an older person, and you can tell that it's an older or younger person. Well, it's just a silhouette. So why is that? It's because the tip of the nose does go down. Gravity is the biggest force on the planet. Having said that, it doesn't change in 10 minutes, and it doesn't change in a year. So over the course of a lifetime, it goes down, which is why people who are in their 30s and 40s or even 50s will say, well, it seems to have gone down a little bit. But in general, because of the scar tissue that's made when you're doing a rhinoplasty, usually the noses stay pretty in place. But of course, over many decades, it does change. That's one thing, that it's not like a car. It really is. Our human bodies, we change. We are dynamic living people, and but noses stay pretty set, except over many, many decades.
And the second part of the question, so someone's asking if they get it at their 40s, wanting a more lifted, narrow nose, will they have to get it retouched in time?
No, I don't think so. I think basically if you have it in your 40s, you're good. And hopefully you'll live to be 100. And, sometimes people, just for a lot of cosmetic procedures, people go, oh, I'll do it now because when I'm 80, I won't care. That's not true. Many people are living to be 100. So think good and think longevity. And but yes, if you do it in your 40s, you're good. You won't probably need to do anything again.
And someone here, so sorry to hear this. It looks like someone had a rhinoplasty and is looking for a revision now. So does this person asking, I mean, do you need to wait the full year for any sort of revision procedure?
Yeah, so I guess it depends on what's the issues. For the tip is really, you have to wait a total of a year. But what's good is that what you don't have to do is you don't have to wait
that long to try to think of what to do to make it better. That's why I like the vector program, because you can do that at any time, because it's the operation without having the operation. I think the reason people like to wait a year before they do a revision is because things change, especially in the tip. Things will change a lot in between 9 and 12 months. And I would say half of my job is holding people's hands to in all of these operations. Like, it depends on which one for how much time, but patience is not something any of us have enough of. And so I think the short answer to the question is, you're welcome to come in and see what it would be, but the exact timing depends on what the issues are.
Let's see. If you are happy with your nasal bone but unhappy with your deviated septum and cartilage, is that considered a full rhinoplasty or more cartilage manipulation?
So I think that's the whole question about full. So I think that sometimes people talk about tip rhinoplasties where it's just the tip. I think the main thing to understand about rhinoplasties is when you change one thing in the nose, it definitely affects what other parts of the nose do. So that's why it's not exactly like a sculpture, because when you change the dorsum, the other parts of the nose can be affected. That's also why it's helpful to do the morphing program. But people, that word full, people don't want a full facelift. They don't want a full rhinoplasty. They don't want a full anything. They just want to do a little something. I get it. We all want to do the thing that's the least invasive, the least costly, the least everything, but not the least good. We want the best good. So I would say I'm happy to take a look and try to help, but the word full is a little bit confusing.
What's the difference between open rhinoplasty and closed rhinoplasty?
So the difference between open rhinoplasty and closed rhinoplasty is that closed rhinoplasty, all the incisions are inside the nose. And open rhinoplasty, they're all on the inside except for a very small one that's on the very undersurface. But more to the point is that in an open rhinoplasty, you lift off the layers of the nose so you can get a more detailed visualization. However, I would tell you that I do both open rhinoplasties and closed rhinoplasties depending on the situation. When I was just starting in practice, closed rhinoplasties were going a little out of favor and open rhinoplasties were coming into favor. Now, decades later, open rhinoplasties are going a little more out of favor and closed rhinoplasties are coming back into favor. So, the fact that we're sitting on a round planet is not surprising that things come around. I think the most important part is you want to be able to see what you're doing and feel comfortable in being able to do it with either. So I think it's important to know how to do both, and I do both.
Like, we have so many questions coming in here, guys. So thank you so much. I just want to kind of preface, if we don't get to all of them, that we will be reaching out to you. Everyone attending today will be receiving a text at the end of this event. If you reply back the keyword Korman, I'll be reaching out to contact you, can assist in scheduling a consultation. So please, if for any reason your question isn't answered on this platform, we can always have a private conversation and make sure to get you those answers. Just trying to scan through here. I'm like, it's exciting to see all the interaction. So thank you so much. Keep it coming. Interesting enough, lots of questions just about septoplasty. So I think to kind of preface too that septoplasty is different than rhinoplasty. One person's asking the pros and cons of doing it, but I can say they're two separate things that can be done together in a sense. So maybe Dr. Korman, can you elaborate on rhinoplasty versus septoplasty?
Yeah, so first thing to understand the septum is that thing in the middle of our nose that separates the two sides of the nose. And the septum has a cartilage component and a bony component. So septoplasty is for two reasons. Septoplasty can make the nose crooked if the septum is crooked, and or deviated is the official word, but it can also help with the breathing because if one side is clogged. So often I'll do what's called a septorhinoplasty, where I will use some of the septum in the aesthetic part of the rhinoplasty. It's really important that tip support and nasal support is maintained. When septoplasty is done by itself, it is done specifically because there is something uh, that's not great about the actual septum. It's deviated. Mostly that's the issue. So when you do a septoplasty, it will not change in general how the nose looks. It's just about the breathing. A rhinoplasty implies that that you're not doing too much to the septum. In fact, a lot of these operations are septorhinoplasties because the septum is an integral part of the nose.
And then how long is a typical procedure and what kind of anesthetic is suggested?
So the typical length of the procedure, I would say, is somewhere between 2 and 4 hours. It really depends on what we're doing. Sometimes if there are revisions, it could be longer depending on what you're doing, but that's what I'd say between 2 and 4 hours. And the question about anesthesia, I think that it is a much more comfortable operation to do it under general anesthesia. We have our on-site fully accredited ambulatory surgery center, which is directly across the street from El Camino Hospital. We use only board-certified anesthesiologists that are part of the El Camino Hospital group of anesthesiologists. If there is a small tip surgery, that can be done under local or under conscious sedation. But in general, the general anesthesia is a better operation. It's really important that you don't just have the science of anesthesia, but the art of anesthesia. And that's why we want patients to have a very excellent experience, both from the surgical result and the anesthetic result and the whole overall experience of their rhinoplasty or septorhinoplasty.
And then more kind of on recovery. So is the recovery painful, and when can someone go to work after having rhinoplasty surgery?
So I think a little bit depends on whether you mind people knowing you did anything, but I would say in general, after a week, I think is fine because the splint comes off. And yeah, your nose is still swollen, but it's totally usually fine to go to work. It depends if you work at the top of a tall building or you're a deep sea diver, maybe not. But in general, if you are and work in an office or work at a desk, you can do that. And you can do it on Zoom, all those things. Can you do it sooner? Well, you have a splint on your nose. So if you have a splint on your nose, then it's a question of whether you mind people knowing that you did anything. And you can come up with many stories. But I think in general, a week.
And a lot of what we've talked about, rhinoplasty, you typically think making the nose smaller. There are some people who are saying they want to build up the bridge on their nose, and another who feels her nose tip is more upturned, like Miss Piggy nose. So for those two cases, what is different there than taking down a larger nose?
Yeah, so a long time ago, people used to think small noses make them bigger, big noses make them smaller. And really, it's a combination. But if you're trying to build up the bridge, there's a lot of ways to build up the bridge. Some are with implants, some are with using your own tissue. And I do it many, many different ways. And a lot of ways I give patients choices about how they would like their to be built up. And it's when you do to the bridge, then it affects how the nose in general looks. So that's why it's, again, good to try to do the operation without doing the operation so you have a sense of it. Also, it helps me to understand how much you want to build up your bridge. So that's for building up the bridge. If you feel like your tip is upturned too much, that is if you want to be technical about it, then I often use something called a septal extension graft, septum. I take a piece of septum and then that helps to lower the tip. So there's lots of different ways to do these operations, but both of those are definitely in the wheelhouse and can make better for you.
And then are any nerves cut during the surgery?
So whenever you do kind of any surgery, whenever you're cutting skin, the little nerves can be cut a little bit. It's important to understand that we have two main kinds of nerves in our bodies. We have sensory nerves. Those are nerves so that helps us feel things. And then there's motor nerves, things that help us move things. So in a rhinoplasty, in general, these are all the ones that are cut are sensory nerves, but they are not main nerves. So in general, the sensation should all come back. And nerves grow at about like hair, like about 1 millimeter a day. So it's normal for there to be some numbness for a few weeks, potentially even a few months, but you're not getting into any nerves that are motor nerves that make something move, unless of course you can twitch your nose. And if you can do that, then maybe you can make a lot of things happen, because that's how magicians work.
Awesome. Just trying to make sure we got through most of these. It's a questions, septoplasty insurance. Dr. Korman mentioned refers, if it's just a septoplasty, as a colleague, an ENT will often do a functional evaluation. Just making sure, again, if we didn't get to anyone's question, we can follow up with you after. I think the one burning question that everyone seems to be asking is, what is the price? That seems to be kind of unanimous here. So usually all these procedures are really, really customized, that noses are not one size fits all, nor should they be approached as such. So I'd say on average, this can be anywhere from $20,000 to $25,000 for rhinoplasty procedure. We are offering everybody joining us tonight an amazing special. So it is $16,999 for rhinoplasty, completely inclusive of OR cost, anesthesia, post-care. During the consultation, yes, that does include imaging, not scanning, but imaging at the consultation. I think that's kind of the best part. It's a very collaborative process where you, the patient, works with Dr. Korman to come up with what you like, what he can do for you. And that's the fun part, is you really get to see before your eyes the potential outcome. So I'd say that's the most important part of the consultation. It's also done again at the pre-op. So all that's kind of included in tonight's special pricing. And thank you, everyone. I really appreciate just the questions, the feedback. Saying, does the price depend on the amount of work? That's kind of why we give ranges with any procedure, is that it's just that it's customized. For some people, it could be 2 hours. For others, it could be 3.5 hours. So yes, all very customized. Happy to talk to each one of you one-on-one to give you more information about that. And if you want to talk more, just a reminder, you'll receive a text at the end of this, respond Korman. That way I will get your information and be reaching out to you personally to assist. So I think that about wraps us up here.
So thank you, everyone. And the most important thing I just want everyone to know is that the operation is done for your benefit. It is really for your benefit and what you need. And I try to make it so that the cost is not about what the part I do. All the parts that I do is all part of the same thing. The only difference in price has to do with the time. So it's the facility and the anesthesia that is what makes the difference. But what I do, it's all one price, because I want you to do the right thing and not some lesser thing because it's less expensive.
Wonderful.
So thank you.
Thank you, everybody. Have a good evening.